with the Center for Pain and Stress Research, and tonight we're going to be doing a tutorial on the Dolphin Neurostim. So if you have one, please do get it out. So if everyone will also do me a favor and mute your microphones because this is being recorded. So anything you say in here, you'll get a chance to hear it tomorrow because you're going to get an email link and you can watch this as much as you would like. So if you guys will mute your microphones for me, we're going to do about an hour of tutorial tonight on the Dolphin Neurostim, and then we're going to have about half an hour for questions and answers after that. If you have questions, you can type them in the chat box, and I will answer them at the end, or you can ask them in person at the end as well. So if you will grab a Dolphin Neurostim, we are going to go over all the parts of this, how to change batteries, what the buttons are for. We're going to go over how to find points with it. We're going to go over how to do basic acupuncture point, motor point, and trigger point location. And we're also going to be going over how to do vagus nerve stimulation with this, as well as scar release. So that's a lot in an hour. So if you don't get it all, you're going to get an email tomorrow with a link, and that will allow you to view this video as many times as you like. So if you miss a part of it, you can certainly go back and watch it again. You're also going to get a link, which is an invitation to be part of our Facebook forum. I do recommend that you join that. It's a great place to ask questions for other people who do this therapy and get them answered, as well as to network with other people who may be in your area, who may be a little more knowledgeable about this than you are. So anyway, without further ado, here's the Dolphin Neurostim. There are several different iterations of it that you may have seen. The most current one is the one with a blue tip like this. Then there's a one with a white tip like this. And then there's a black one like this. So this is the most current one. This is the one we're going to be doing our demonstrations with. If you do have older models, they do have programs available for you to trade up. You can trade in your older equipment and get newer equipment at a greatly reduced cost. But you can contact the company about that. All right, so starting at the tip, we have a biocompatible alloy tip here. You will notice that if you push on it, it does kind of push back into the housing a bit. So there's a spring back in here. And that becomes important for when you clean these devices. We don't recommend dumping any liquid on here because liquid can run down in there and it can foul up the conductivity of the tip. Instead, we recommend just using an alcohol swab or any kind of cotton swab with a little bit of alcohol on it. Those work great. Moving up from there, there is a black button right here. You will notice as I push it, absolutely nothing happens. That's because the device is off. But if I turn the device on, you will hear a constant tone. And if I flip it over, you should see a green light right here. And you can see there is not a green light right here. So as soon as you turn this on, there are two things that should happen. You should hear a constant tone, and you should also see a green light here. If you don't see this green light, it means you need to change the battery. So we're going to go ahead and go over that at this point. So to change the battery, you either need a screwdriver or even maybe just a coin. Either one of these works fine. If you look at the Dolphin Neurostim on the back side, you will see there is a screw at either end of here. And this is the part where the company really wants me to talk to you guys, because one of the biggest customer service problems they have is people who take these screws out trying to change the battery. That presents all kinds of problems. The device comes apart, parts go flying everywhere, you void your warranty, you have to send it back to us to get it put back together. There is a very nice little battery compartment on here, and that is how I recommend you change the battery. Doing anything other than that is not great. All right, so I'm going to use a coin here. I'm just going to put it in the little slot right here and pop this open. And you will see that they use a standard 9-volt battery. We do recommend one of 3 types of batteries for these devices. This is a tight fit too, so you want to give it a little pop to get the battery out. We recommend either Energizer batteries or Panasonic batteries or Duracell batteries. So any of these are great. I would not use anything other than these. The reason for that is twofold. One is that when we manufacture these devices, we wanted to get rid of the little wire dealy bop that you push down on the ends of the 9-volt batteries. And we did that because those always break. And so that was a problem for people. But the problem now is that not all 9-volt batteries are the same size. So if you go and you start measuring 9-volt batteries, these are all the same length. But if you get into other brands of 9-volt batteries, oddly enough, they are not going to be the same length. Now, AA batteries, C batteries, and D batteries, those are all fine. But in the world of 9-volt batteries, there is some variance in there. So I do recommend not moving beyond these three. The other thing is if you use cheap batteries, even if you find some that fit properly. Hey guys, somebody needs to mute their microphone if you would, please. Let's see. Deborah, you need to mute your microphone. Let's see who else. I think that's everybody. All right. So if you get into cheap batteries, they have a bad habit of dumping all their voltage at once. And that will damage the circuit board inside the device, and then you have problems on your hands. So just stick to basic alkaline batteries. We are currently testing some lithium ion and hydrogen iodine or whatever batteries, but we don't have outcomes yet on how those do for the circuit board. So for right now, stick with these kinds of batteries. One of these batteries will last you for probably about a month if you are an active therapist. So to give you an example, 3 days a week, I do 10 hours of therapy straight through. And with each of those appointments, I use a Dolphin Neurostim for probably 20 to 25 minutes of that. And then 2 days a week, I use them for 5 to 7 hours. And an alkaline battery lasts me for about a month. So you should get a lot of life out of a regular alkaline battery. If you're doing hours and hours and hours of something like vagus nerve stimulation, your times may be a little bit shorter, but you're still going to get good life out of them. Okay. So we want to grab one of our batteries. There is a little diagram in here that tells you exactly how the battery goes in. So we're going to fit that battery in here, and hopefully I have one that's the right. It's charged up right. And when you go to put this top back on, this is a really tight fit. So it's going to feel like it's going to break. So it's going to be a hard snap, but it won't break. It's designed to be a tight fit. If you get a battery that's too short in here, one of the other brands, it's going to rattle back and forth a lot, and you're going to get intermittent contact, and it's going to affect your treatments. If you get a battery that's too long, it actually won't fit in here, and if you try to force it, it will break part of the unit. So anyway, stick with what we recommend. So now I've got the battery in, I'm going to turn the unit back on with this roller switch. Oh, and I have the wrong, let's see here. I have a battery. Let's try this Energizer here and see what we've got. Well, shoot. Oh, here we go. All right. So when you turn the device on, you should see a green light pop on in the back. As long as you see that green light, you can still do a treatment if the light is not green, but it is going to affect the strength of your treatment, and it won't be long before the battery is dead. So we do recommend changing them as soon as possible. So this roller switch also will increase the intensity of the device when you're doing a treatment. So you're going to be holding the unit like this. We recommend putting your thumb on the metal plate here and holding your finger over this button, but you can actually change the intensity of the treatment just by rolling this little switch right here. So if it's a little too much for you, you can back it down without making any major adjustments. Now, if I turn this on, when I go to do a treatment, so when the device is on like this is called the search mode. So this allows you to find acupuncture points, trigger points, and motor points. Once you find a point, and we're going to demonstrate the point location in a minute. Once you find a point, you're going to push this black button down, and you're going to hold it down. And as long as you hold this button down, you are actively doing a treatment. But as soon as you release a button, the treatment is done until you push the button down again. So just because you find a point, it's not really going to do anything at that point. You actually actively have to hold this button down. If you move up from here, you'll see a little tiny black button. If I push this button, you'll notice that the device goes silent. But if I flip it over, you see there's a flashing light right here. So what I've done is I've switched on a timed treatment. So in this mode, I don't really have to push any buttons on here. The device is actually going to run in a silent mode for anywhere from about, let's say, 12 to about 14 minutes. It varies a little bit depending on the strength of your battery. The device counts how many electrons go through the tip of the unit. So if you have a really strong battery, it's going to be a little bit shorter. If you have a battery that's starting to die a little bit, it's going to take a little bit longer. So it's not an exact period of time. But what it does do is ensure that people aren't going to do hours of vagus nerve stimulation. What we had a problem with in the past with these devices is that not only does it beep every 30 seconds, once you put the constant treat mode on, it also will run for hours at a time. And we had people who were doing vagus nerve stimulation who were falling asleep with vagus nerve stimulation on and doing it for 6 or 7 hours, which can leave you feeling pretty groggy the next day. So anyway, we put a timed treatment on there. It's a great little feature. If you're active in a physical therapy or occupational therapy clinic, you can hook a patient up to vagus nerve stimulation. And once you hear the device come back on again, you'll know that that treatment phase is over. So at that point, you can either initiate another treatment phase or you can just move on to something else. It's also a good way just to kind of track what's going on. If you're supervising a room full of patients, you know about where people are in their treatments. Okay, so moving to the back of the unit, there's a metal plate right here. It is really important when you are doing treatments that you either A, touch this metal plate, or B, with certain treatments, you're going to have an oval shaped electrode that fits on the back of here. Okay. So one of two things has to happen. You either have to have an oval electrode on here, which is going to have a wire that runs to your patient, or you can touch this metal plate. So electrons have to come out of the tip of this unit and circulate back into here to complete the circuit. So if you are either not touching the patient with the tip of the unit and it has to touch your skin, or you don't have this connected to an electrode on your patient, or you're touching this and then having skin contact with your patient somewhere to complete the circuit, you can't do a treatment. So it's important to make sure that there's a place for electrons to come out of the unit and a way for them to get back into the unit. Otherwise, you're just basically doing acupressure. Okay. Moving up from there, there are two little slider switches here. Let's see if I can get it to focus for you. And at the bottom here, you will see it says wet, normal, and dry. So that feature will determine the sensitivity of the ohm meter. So this device has a point finder in it. What it does is measure how conductive your skin is. So somewhere back in the 1950s, they were measuring the conductivity of the skin of human beings. And they found out that there were some areas of the body that seemed to conduct better than others. And I don't know who it was who figured out, but they figured that most of these points really look like they were in the same location as acupuncture points. So when they correlated it with an acupuncture chart, they found out that indeed acupuncture points are the most electrically conductive points in the body. So there's some science behind what an acupuncture point actually is. Now, a myofascial trigger point, as defined by Janet Travell, who wrote the myofascial pain and trigger point books and defined what a trigger point is, those points are also highly conductive to electricity. And they're essentially the same points. And motor points, which are the most electrically active points in a muscle, are also acupuncture points. So all of them basically fit in the same little sphere, and this will find all of those. And what you'll have to pay attention to is the consistency of your patient's skin. So I live in the United States. I live down here on the coast in Georgia. Things are pretty humid down here. People's skin either tends to be in the normal range, or it tends to be kind of wet in the summertime because they get sweaty. And if somebody comes in with sweaty skin, that's salt water, and salt water is very conductive. So if I then go try to find points on sweaty skin, what happens is that everything looks like an acupuncture point because everything is very conductive. So I have to adjust the sensitivity of this ohm meter over to the wet setting. Now, if you live in a dry climate, and are treating people who are in skilled nursing facilities or hospitals, very often people are very dehydrated, just because the air conditioner's running all the time. And in a lot of skilled nursing facilities, people don't drink enough water. People's skin becomes very non-conductive to electricity. So you need the ohm meter on here to be more sensitive. So you need to slide it over to the dry setting. So the dry setting is the most sensitive. When you're first learning how to do this, I do recommend putting it on the dry setting. That's going to be the easiest way to find points. And as you get better at it, then you can start playing with this little slider switch right here. Okay, so up from there, there's a little polarity slider switch, and you can see there's a negative symbol here, a plus symbol here, and also a plus minus symbol right here. So the minus symbol is negative, which is sedation. So that's for bringing things down. So in the world of acupuncture, you can either bring things up or bring things down. So most of the conditions you're going to be treating are conditions of excess. There are things you're going to want to bring down. So some examples of that would be a migraine headache, blood pressure, an asthma attack, shingles, diarrhea, constipation, concussions, depression, fill in the blank with any kind of negative thing in the body. Most of them are conditions of excess that need to be brought down. So if you left this unit on this negative setting, 98, 99% of the time, that would be exactly what you needed. And indeed, in the early days, the only thing you could get was negative polarity devices. However, technology's progressed. So if you flip this on the positive setting, that's tonification. That's for bringing things up. So conditions that need to be tonified are conditions that are deficient. So that might be anything from, say, Bell's palsy, where somebody's face is drooping a little bit. That's a condition of deficiency where you'd want to bring that up. Maybe when you're working with somebody who was having some stroke symptoms, not necessarily in the area where their problems are, but acupuncture points that treat the brain, you might want to bring things up a bit for those. Depending on what you're doing, there are some negative polarities as well. Also, if you get somebody who is fatigued all the time, you might want to tonify their kidney chi. So you might treat, say, kidney 3, which is a source point for kidney energy, and that gives your adrenals a boost. So there are points that can be used. And also, if you wake up with puffy, dark circles under your eyes in the morning, you can tonify on positive a point called kidney 3 on your ankle. This is a sign of depleted kidney energy. If you have puffy dark circles under your eyes, you can tonify that, and it really makes a huge difference. So there's a beauty tip for anybody who's interested. Okay, so the next setting we have on here is a little plus minus setting. Let's see if we can get it to focus again. And that's a biphasic current. So it's going to flip the current back and forth. Most of the time, you're not going to use that. There are two primary times that you'll use that setting. One is when we treat scars. I do that a lot. I do a lot of scar therapy in this practice. And the other is when you are doing certain types of vagus nerve stimulation. Not most of it, but some of it we can use the biphasic channel. So that's when you're going to see that come into play. Okay. So that is all the features of the Dolphin Neurostim. And so now we need to go over how to use this to find points. Now, if you look at any of the literature that comes with the books, so there's a book that's called Natural Health that comes with the device, and you can turn to any page in here. I'm going to flip on one that says shoulder pain, but it doesn't really matter which one you look at. All of them, you will notice that next to the numbers of the points, so all the points are numbered, there's going to be a plus or minus symbol. So that's actually going to tell you whether to use the plus or minus on your device, okay? So all the protocols we have listed out for you guys, whether it's in the vagus nerve book or in this natural health book, all those actually have the polarity next to them. So there's no questions about it whatsoever. So you shouldn't have any problems with that. If you do have a question about it, you can certainly post a question on our Facebook forum and ask. But for the most part, just think about it. Is it too much or is it too little? The nice thing is using the wrong polarity on here is not going to permanently hurt somebody. You might piss off somebody's headache a little bit, but you're not going to cause any permanent harm. And if you treat the wrong polarity and somebody, say, like if you treat a point and somebody's shoulder pain gets a little bit worse, if you change the polarity on the device to the opposite polarity and treat that same point, what you'll find is it makes it better. So you've got the right point, you just have the wrong polarity. Okay. All right. So any of these, let's see. Let me grab something out of the literature here and we can find a couple of acupuncture points. I guess I'll just use this book right here. Let's see. I'm going to look up something that's got some basic acupuncture points that are easy for you guys to find. Oh, let's see here. I should have marked this ahead of time. Okay. So in the back pain protocol, in the upper back pain protocol in your book, so just it's all done alphabetically. Just look up B's here. It just says back pain upper. We're going to look at this acupuncture point right here, which is called small intestine 3, SI3. Small intestine 3. So to give you guys just a little bit of background, in the world of acupuncture, They believe that there are these energy lines that run through your body called meridians. In Chinese, each of them has a specific name, like the meeting of three rivers and, um, the, yin pooling point. They're all specifically named. So we don't have those nice little names. We just call them by the organ that's represented by the meridian and the number. So you might have spleen 1, kidney 3, lung 6. So each of the meridians in the body is named after an organ system, and the points are numbered along there. So you can get one of these dolls. There are tons of apps online that are free that if you want to look up acupuncture points, you can certainly do that. That's not a hard thing to do. But we're going to look at the small intestine 3 point. And to find it, if I take my hand, you can see there's a line that runs from between my index finger and my middle finger, and it runs across and over to the edge of the palm of my hand right here. I believe for the palm readers, this is what they call the heart line. So if I take my hand and make just a real light fist like this, you can see that it makes a little lip of skin right there at the end. So the acupuncture point that we're looking for is right at the end of that lip of skin. Let's see if I can change this around so you can see it. Let's see here. Here we go. So it's right at the end of that crease. It's about a 45-degree angle kind of in towards the bone right there. So I'm going to put a little red mark on there with this pen, and we're going to see if we can find that point using the Dolphin Neurostim to demonstrate how it works. All right. So I turn the Dolphin Neurostim on. Make sure I got a green light here, which tells me my battery's good. I'm going to put my thumb on the metal plate. There's a tendency for people to want to put your fingers on this plate, but then when you go to try and push this black button, it becomes quite difficult with your thumb. So we do recommend just cradling it in your hand like this, and it's just much easier. So we're going to take the Dolphin Neurostim, and I'm going to have to, actually, I may have to roll it over and do what I told you not to do just so you can see it. But I'm going to run this device on the, let's see, I'm going to put it on the normal setting for skin type. And I'm going to put it on the negative polarity because small intestine 3 is a stiff neck and spine point. It's used a lot for spasmodic torticollis. So I'm going to run this down this crease till I get to the end. And when I get to the end of the crease, you'll see that the light goes out and the pitch goes way up. So two things should happen. If you have problems with hearing high frequencies, you're going to have to watch the tip of the device. You're going to have to watch for the light. But what's going to happen is that the light should go out and the pitch should go way up. So the higher the pitch is, the more conductive the point is. Now, once you find it, so we're going to go back and find it again. Once you find that point, you can then, making sure that you have your thumb on the metal plate, take your middle finger and push this metal button. We're going to count out about 30 beeps or so. So each of the points in the book that you have with the device, figure on a count of about 30 beeps per point. Can you go longer? Sure, you can certainly go longer on these points. But we set up our protocols so that physical therapists and occupational therapists and people who work in therapy departments and hospitals can get most of these protocols done in about 15 minutes. So that's how it's kind of set up. If you have more time, you can certainly spend that. And because this is a point that works for stiff necks, you actually want to do some active range of motion with your neck while you're treating the point. We did actually teach this protocol to All Children's Hospital down in Tampa. They were using it for spasmodic torticollis in babies. It actually worked really, really well. You can actually use this device for small children. That's not a problem. Just need to turn it down a little bit. All right. So another acupuncture point that is easy to find that you guys can practice with. Let's see here. Let's look at triple warmer 5 right here. Okay, let's see here. Let me find a good example of it. All right. So I'm looking at the elbow pain protocol right here. And down at the bottom, you'll see there's a point that's right here in the middle of the wrist. It says TW5. TW stands for triple warmer. That is a meridian in acupuncture that is it's a meridian that is kind of a homeostatic meridian. It balances out the energy between what you breathe, what you eat, and what you eliminate. So we have triple warmer 5 right here. To find triple warmer 5, you take your wrist and you bend it back and find the wrist crease. And from there, you go 1, 2 thumbs down. So it's easier if you're doing it on somebody else, but there's 2 thumbs down. And right in the middle, right here between the bones, is going to be triple warmer 5. So we're going to mark that. So I have a little X right there. I'm going to take the Dolphin Neurostim. I'm going to flip it over, hold it the wrong way so you guys can watch the light. And I'm going to pull this down. And as I get over the point, the light goes out and the pitch goes up. And I can go back to that same point every single time. So it does take a little bit of practice to learn how to use this, the point finder. There are a few pitfalls to this. I'd like to go over them right now. There's what you can do right and there's what you can do wrong. So absolutely the thing that you can do wrong is to push down really hard with this device. So if your technique for finding points is taking this and kind of hunting and pecking like this, you're making a big mistake. Because if you push really hard on the skin with this device, it compresses the skin. When you compress the skin, it actually makes it more conductive to electricity. It moves the tissue underneath closer to the surface, and it's easier for electricity to pass back and forth. So you can actually create a false positive. So you don't want to push down really hard with this device. You want to just gently just move it around like you are looking. So you have the heel of your hand is a nice fulcrum. So if I was looking for triple warmer 5, I would probably rest the heel of my hand like this and then just pull the Dolphin Neurostim around like this. So turning it on so you can see it and pulling it across the skin. And you can see it kind of flicker a little bit. And then as I get over it, the light goes out. There it is right there. So if you find that the pitch is really high, but the light won't quite go out, one of two things is happening. You're either not directly on the point or you have chosen the wrong sensitivity, okay? That doesn't mean you don't have the point. That just means that the light won't go out. So between the pitch of the unit and the light going out, one of them I consider to be much more important than the other. As long as you can hear higher frequencies, the pitch of the unit is much more important because that's going to tell you when you're at the absolute most conductive point. The light is kind of secondary, but it's a nice tool to have as well. And this is a very accurate point finder. It was designed by an acupuncturist to be the most accurate point finder on the market. And it was so accurate when it first came out, they had to back it off a little bit so the people who weren't acupuncturists could find points with it. So it's going to get you really close to the acupuncture points. Okay. So that's how you basically find a point. Again, you want to hold the device and you want to make sure you have, so if this were somebody else's hand and I were doing a treatment, I need to have my thumb on the metal plate. I need to make sure that my wrist or some part of my body touches down on their skin and that the tip of the device is in contact. So I have to have skin contact with my patient and then contact with the tip. Now, I can't do this on clothing and I couldn't touch the person's clothing and expect to find points, okay? So you've got to have skin to skin contact. This will go through a lot of clothing, but unless you've had a lot of practice to know where the points are, I don't recommend that as a strategy when you first start out. Okay, so that's how you're going to find points. So that brings me to a very important point, and that's this. There are 2 times when I recommend you look at the light on this device. If you start wondering about the light at any other point, it will absolutely drive you bananas. The times you want to look at the light are when you turn it on. That tells me I've got a good battery. And then when I'm looking for points and I'm looking for this light to go out. Those are the 2 times you want to look at the light on here, because you'll notice that when I push the button, you can see the light blinking here, but then you can hear it. I'm pushing the button and you can hear it beeping, but the light isn't blinking. So depending on how intense you have the device, the intensity of it, you may see a light blink, you may not. So don't start worrying about whether the light's blinking or not blinking. That doesn't really mean anything. The important things are, do you have a good battery and did you find the point to begin with? After that, it's pretty easy. Okay, so that's how to go about finding points. There are tons of protocols in this book. There are available some other protocols stuff that we have. Let's see if I have anything here that I can show you guys. Let's see. See if I have a copy of it. I don't. Yeah, we even have like horse acupuncture points. So we got protocols for all kinds of things like nosebleeds and horses and stuff like that. Any of our courses that you take will come with more protocol books. So if you take one of our concussion protocols or our introductory seminars or our SCAR seminars, like each of those has its own set of protocols and points beyond what you see in this book right here. And they're just advanced protocols, and they do require some training to be able to utilize them properly, which is why they aren't in this basic book. Okay, so that's finding points. So now we need to look at how you would go about treating a scar and doing vagus nerve stimulation. So let's talk about scars for a minute. Scars are one of my absolute favorite things to treat. So I've been a therapist for, gosh, almost 30 years now. I've used the Dolphin Neurostim for probably 25 years of that. I've worked in neurology clinics, neurosurgery clinics. I've worked with physiatrists. I've worked in women's health for about 15 years. And I get involved in research things and I speak at seminars. I just got back from the Society for Weightlifting Injury Specialists up in Canada. And they like our stuff because we help heal weightlifting injuries, the crazy injuries they get. So I've had a lot of experience using this, and I've had a lot of experience using this on scars. So there are a lot of ways you can go about treating a scar. You can do manual therapy with your hands. You can do skin rolling. You can do cupping. You can do scraping of one kind or another. All of them are basically versions of gua sha, which is an ancient Chinese technique. Everybody likes to say it's their own new thing, A-stem or whatever they want to call it, but it's all gua sha in one way or another. You can do some needling techniques, and you can even do injection therapy into the scar with procaine to try and electrically repolarize the tissue. And all those are decent interventions, but this is the fastest one I've seen. Like it's way faster than what I can do with my hands or what I can do with cupping or what I can do with scraping. Scars are an electrical problem. There's an electrochemical problem going on there. And the way you correct that is by creating a piezoelectric effect, like with something like myofascial release, or using microcurrent itself, which does the job much faster. If you're using like injection therapy and injecting procaine into there, that you're trying to use a chemical to electrically flip the charge of the scar. So this is how it works. Scars are not very conductive to electricity. They tend to have a positive charge. Most body tissue is a negative charge. So when you treat scars, you're going to need 2 Dolphin Neurostims, not one, but you gotta have 2 of them, because you have to be able to bounce electrons back and forth through the scar tissue, okay? If you were to take like a normal TENS unit and say try and put pads like this on top of a scar, let me put that so you can see it. If you try to put pads on top of the scar, what's going to happen is the electricity takes a path of least resistance. So it's just going to go around the scar. It's not going to go through the scar tissue itself, because one of the problems is scars are non-conductive to electricity. So we need to make them more conductive. So how do we do that? Well, we take 2 Dolphin Neurostims. We put one on a negative setting and one on a biphasic setting, and we play ping pong with electrons. We're going to bounce electrons back and forth through this scar to electrically repolarize the tissue. Once you do that, what we know is that you get about a 20% reduction in density. And that's permanent. So you could do one treatment today, and you could do one treatment 6 months from now, and you'd have roughly a 40% reduction in the density of the scar. Or you could do 4 treatments over the next 2 weeks. So you're not going to lose ground when you do this. It's just a matter of how often you can do it. And so why is it important to reduce the density of the scar? Well, the less dense the scar is, the more pliable the tissue is. So why would you want to treat a scar in the first place? Well, number one, scars can be painful. So what happens is when the scar tissue gets laid down, the nerves go from deep to the surface, and the scar tissue will bind around those nerve endings and make it very, very sensitive. You can have scars that you can barely touch. I treat a lot of C-section scars and mastectomy scars that were incredibly sensitive, and we had to work on those to desensitize them. Other reasons you might want to treat a scar. Scars can cause range of motion issues. So, for example, if you've had a knee replacement surgery, um, you'll go through all the therapy, and somewhere near the end, there's always a few degrees of range of motion you can't get back. And the doctor usually says, "Well, that's because you got some scar tissue in there." Well, you can treat that, and it's something that isn't always something they can treat in the therapy department of the hospital if they don't have any microcurrent equipment. They just aren't able to deal with the scar tissue in the way that you can do it at home or as a therapist yourself. So it can affect joints in one area or another. It can even affect things from a distance. So something I have seen in the past is people who've had different types of scarring. Let's say, for example, in women's health, we used to see a lot of people who had C-section hysterectomy scars. So it tends to pull you forward a bit like this. And you see a lot of posterior neck pain, headaches, and low back pain from C-section hysterectomy scars. Open heart surgery scars, tons of pain back through here. And you can massage that, you can hum to it, you can do whatever you want to. But treating this isn't the solution. You got to treat the scar itself because it's pulling everything forward. And so all this is being pulled on. I've even seen range of motion issues where somebody had a hip replacement surgery and had a frozen shoulder. And they didn't have a shoulder problem. They had shoulder injections and all kind of massage and stuff and weren't any better. When we found out they had a hip replacement scar, it was pulling through the connective tissue, through the fascia, all the way up through that area. Okay, so it's pulling all the way up through here. And once we released the scar, you had perfect range of motion in the shoulder. So scars can affect movement from a distance. Your entire body has a coating around it between the muscles and the skin called fascia. It's like a body stocking. And if you stick that down anywhere with either a surgical scar or a scar of some kind that's from a trauma that you've gotten somewhere at some point in your life, then it can cause problems. Why else might you treat a scar? Scars can cause swelling. If you have surgeries, any surgeries in here, a lot of times you'll see swelling down in the feet and ankles. So lymph has to move through this area to get dumped back in right up here. And if you cut the areas where the lymph flows through, so lymph doesn't go through arteries or veins or anything like that. It goes through kind of sort of potential space between muscles and the skin. And if there's something binding it down, the lymph just gets stuck back there. So then you end up with like a toxic waste dump down in your foot because the return flow of lymph isn't doing what it needs to do. Also, in the world of acupuncture, any scar that cuts through one of the meridians is considered to be a blockage of energy. I have seen people post-surgically, like 6 to 8 months later, start having things like panic attacks, like weird manifestations they've never had before. And you go and you treat this little tiny scar somewhere where they had a cosmetic procedure, like even a small cosmetic procedure, like having a mole removed or having a little nip and a tuck on your face. And those are the ones people don't tell you about. They'll tell you about like the big organ surgeries. They won't tell you about the cosmetic surgeries. And some of them are pretty obvious that they've had them, but you need to look kind of back behind the ears and through here to see if they've had things pulled back or had their ears done. Excuse me. Ooh. So, the other reason you want to treat scars is because scars electrically affect your nervous system. Scars are, in a way, kind of like a battery. They can hold a higher electric charge in the surrounding tissue. Normal body tissue holds a resting charge of about 80 millivolts. Scars can hold a resting charge of around 1.6 volts. So what happens is that they will stimulate the local sympathetic nerve fibers, not a little bit, not a lot, but a little bit 24 hours a day, 7 days a week. It actually winds up your fight or flight response. So a very old scar from, say, like falling on the steps as a child and having a little scar under your chin, because a lot of people end up having that. It doesn't hurt. It's not sensitive. It's not restricting range of motion. It's not doing any of those things. But if you treat that scar when somebody's had a newer injury, that scar is winding up the nervous the nervous system to make a newer injury hurt more. So releasing older scars is sometimes the key towards getting people pain relief to more recent injuries. All right. So how do we go about treating a scar? Well, we need a scar to treat. And so we're going to draw a little man up here and we're going to pretend like he has had open heart surgery. And we are going to proceed to do a little scar treatment on him. So let's get a little guy up here. He has a very unhappy face because he has had a heart attack and had open heart surgery. All right, here's our little guy. And he's had this scar right down the middle of his chest. He's got this zipper right in here. It's causing all kind of problems. He's having pain in his neck. Put some red in there. It's all hurting in the back of his neck and his upper back. And he's generally pretty miserable. So we need to go about treating the scar. So what do we do? All right. Well, we can't start out treating on the scar because the scar is not particularly conductive to electricity. So we need to push from one side and pull to the other. That's where having two separate sources of electricity come in. So you have these two sources of electricity that are connected kind of in the middle by you. So we're going to push electrons from one side of the scar using a negative polarity. So we're going to use a negative polarity on one side of the scar. It doesn't matter which side. And then we're going to use not the positive polarity, but the biphasic setting on the other side of the scar. So that's a little slash right there. So those are the two settings we're going to use. So we're going to take our Dolphin Neurostims, and I'll demonstrate the technique in just a minute. And we're going to start on either side of the scar, about 1/4 inch away from the border of the scar. And then we're going to push the buttons down. You're not looking for acupuncture points. So you're not looking for the light to go out. You're not looking for the pitch to go up. These are not acupuncture points. We're just going to drive whatever current we can through that area. We're going to count about a 10 beat count. We're going to 10 beat count. Then we're going to move down 1/4 inch. Another 10 beeps. And we're going to do that all the way down the scar. So when we get to the end of the scar, we're then going to, I like to flip the units from one hand to the other because it changes the polarity without me messing with the switches. And then I'm going to work all the way back up again, counting 10 beeps each time. So that's 2 passes, down and up. I'm going to do one more pass. So I'm going to end up going down again, down through the scar. And the whole time we are bouncing electrons back and forth through here. It's literally a game of ping pong with electrons. And as you do that, it electrically depolarizes the tissue here. Now, once we've got it somewhat conductive, it then, and what you'll see in some of the literature is they say, hey, look, start at either end of the scar like this and just plug the ends of the scar. Well, I'm going to suggest that since you've got this a little more conductive, it makes a lot of sense to treat here and then move in 1/4 inch segments through the scar tissue itself so that you're all the way, and I'll do that also 3 times with 10 beeps each. So each of those is 3 passes with 10 beeps each, moving about 1/4 inch. So what does it look like in person? All right, I got 1 unit on the biphasic setting. I have 1 unit on the negative setting. The setting down here for skin type doesn't matter because I'm not looking for acupuncture points. I'm going to put the devices in my hands so my thumbs are on the plates. I am going to make sure that my fingers are kind of hovering over here. I'm going to turn the devices on, make sure I got a green light. I need some skin contact with my patient. So I either need for the patient to grab my arm. That's fine. Or I can rest my hands down on the patient depending on how well I know the patient. And I'm going to do a 10 count of beeps. Now I'm going to move down again, do 10 more. Again, 10 more. I'm going to do that all the way down the scar. Once, twice, 3 times. Go to either end of the scar. Once, twice, 3 times. And once you've done that, you'll have a really nice release of the scar. And we have done diagnostic ultrasound studies. The measure you're looking at is called the cicatrix, however you want to say it, gray mean density of the scar. And we know from clinical studies that you will get an average of about a 20% reduction in the overall density of the scar. And it's permanent. Not even laser can do that. Laser doesn't get deep enough to do that. Laser looks good makes surface scars look better, but it doesn't get deep like this. So the nice thing about this technique is you can use this technique to treat deep abdominal adhesions. So if you have had one abdominal surgery, and it doesn't matter whether they cut you open or stuck little probes in you and made little tunnels through there laparoscopically, one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. 2 abdominal surgeries, it's a 100% chance. So if you've had any kind of abdominal surgery, hernia repair, something to, I don't know, remove an abscess, or, had your tubes tied, like any of these little surgeries they do on people or big surgeries, you will probably end up with abdominal adhesions, and that's going to affect your back. It's going to pull you forward and affect your back in terms of back pain. Even if they scoped you, like had your gallbladder out or something like that, there's still scarring in there. You can deal with those scars with microcurrent. You can't get to those scars with needles because it's in your organs, around your organs. You can't get to that with scraping techniques. You can't get to that with laser because it's too deep. There are just so many reasons why you'd want to use microcurrent on those kinds of scars. So it's a very, very effective technique for that. And scars can be a number of things. A scar can be a broken bone. You can get scars there. Scars could be where you hit your head when you had a concussion. You may have some scarring in the cranial fascia. If you had a chronic sprain or strain somewhere, like you always sprain your ankle, well, there's probably scar tissue in there. So there's a lot of different scars you may end up treating over time. What about a scar that looks like this? So let's say this guy has also worked in a paper mill. There's a lot of paper mills down here in Georgia. Let's say that he's had a steam burn. Steam burns are nasty because steam has a lot of energy, and you have this big, huge scar like this. Well, that's not a linear scar. Like, it's a big kind of circular scar. So how do we go about treating a scar like that? Well, you're going to do it the same way you treat a scar like this. It just looks a little different. That's all. So you would start on either side of the scar and just start counting 10 beeps. And you're just going to work around it like a clock. And you just want to keep the units opposite to each other. So the whole time you are bouncing current back and forth through this tissue. That's the game here. It's just to bounce current back and forth. And once you've gone around it 3 times, you can then go through the scar itself and work all that area. Now, this scar is going to take a lot longer than this scar because it's a lot more surface area to cover. But it's still a perfectly, viable scar for getting treatment. It just takes a little bit longer with the timing. It works quite well. I had a guy in here a few years ago who got he had necrotizing fasciitis. And he and 2 other people ended up in the hospital. One of them died. They think it was from some water somewhere they got into. But anyway, he had about 75 surgeries in this area to remove necrotic tissue. Like, as it started to slough off, they had to go in and pull tissue out. And like, that was somebody I had to work on. And it was, it wasn't 1 or 2 treatments. It was a lot of treatments for this guy. But he had so much pain, just pulled up through his groin and down through his sides, and just deep, deep internal pain. He had back pain because of it. Really, really, really yucky stuff. And he was a lot better after we got done with him. I never got him to 100%. There were some adhesions I just couldn't quite get to let go, but he was so much better when he left. And that was, God, that's been probably more than 10 years ago. But anyway, that's just an example of the kind of stuff you can do. How soon after a surgery can you treat a scar? Well, you can do it immediately after. So when you use microcurrent does in the right waveform and frequency. So not all electricity is good for your body. If you run to Walmart and grab a TENS unit off the shelf, or even like an MP TENS unit from a physical therapy place, that's high frequency alternating current. Not good for you at all. Does not promote healing. Will actually raise your cortisol levels and do some kind of yucky things. If you use low frequency direct current, It will increase ATP production 400 or 500%. ATP is adenosine triphosphate, which is mitochondrial fuel, so it ramps up healing. It will increase protein synthesis and also cellular membrane transport. Systemically, it will decrease your cortisol levels. It will increase your VO2 max. It will increase your HRV, your heart rate variability. It will increase your high frequency vagal tone. So a lot of different things that happen when you start treating the body with microcurrent that are positive. Whether you're treating acupuncture points or doing scars, the microcurrent has systemic effects on your body, which are good. All right. So that's taking us through the whole scar thing. So the next thing we need to look at is, what is vagus nerve stimulation? Why would you want to do it? How would you do it? So the vagus nerve is called the wandering nerve. It's the longest nerve in the body. It starts kind of on either side behind the ears up in the brain, comes together in the chest and goes all the way down through here. It is the information superhighway between the brain and the gut. They call it actually the second brain. More information goes from your gut to your brain than goes from your brain to your gut. And it has a huge influence over your sympathetic nervous system, how aroused your system is. So you have your sympathetic nervous system, which is your fight or flight response. Then you have your parasympathetic nervous system, which is the rest and digest functions. And if you look in Oriental medicine, you will see this little symbol right here, which is the yin and yang symbol. So the yin symbol, which is the darker side, is the female side. That's the parasympathetic nervous system. So this is your rest and digest functions here. And then the light side of it is the yang side. That's the male side. So that's the warrior side of things. So that is the sympathetic nervous system. That's your fight or flight response. So you generally, if you're trying to calm things down, you treat parasympathetic points, female points. If you're trying to make functional changes, like treat a frozen shoulder or something, you're going to use yang points. But each of these also has a representation of the sympathetic and parasympathetic nervous system. They actually recognized that thousands of years ago. They knew there was a balance there. So you need to spend about 70% of your day on the parasympathetic side of the nervous system. If you don't, you're kind of screwed. Okay. Your body requires a lot of time for digestion and restoration. And if you are not sleeping well, and if you don't spend enough time on the parasympathetic side of your nervous system, your immune system gets compromised. Your health in general gets compromised because your body stays stressed all the time. If the sympathetic nervous system activates, that's a fight or flight response. That is for immediate danger. When you stay stuck in that all day long, then it's very detrimental to your health. Like, those are the people who die from COVID. Those are the people who have heart attacks. Those are the people who have strokes. Those people who get stuck on the sympathetic side, their systems are already worn down, so they don't have anything in reserve. So doing something like vagus nerve stimulation is going to balance out the sympathetic and parasympathetic balance. I mean, the sympathetic nervous systems. So if you have somebody who is, let's say, an athlete, we work with a lot of elite athletes. They like to use vagus nerve stimulation as a recovery tool from intense workouts. So they do their really intense workout and they do vagus nerve stimulation afterwards, and immediately puts them into the recovery phase, and they can avoid soreness the next day. They can avoid going into what's called overtraining syndrome. If you train too much as an intense athlete, you can go into overtraining syndrome to the point that you don't get any faster, you don't get any stronger. All it does is break down your system. But if you use something like vagus nerve stimulation, you can use that as a neuromodulator. So when you're using this device for vagus nerve stimulation, it is a neuromodulator. It shifts your autonomic nervous system. And it's not just a temporary thing. Like, if you do this over time, you can modify your system so that you're sleeping better, so that your digestion is better, so that you don't get ill as easily. So let me give you an example. I'm 53 years old. I work a lot. Like, I raised 2 children by myself. My kids are 12 and 14, so it's not as hard as it used to be. But still, I'm really busy with that. I do 10-hour days at work a lot of times, and I travel and I teach workshops on weekends, and I lecture at seminars. Like, I'm busy all the time. And then when I get home in the evening, like, I got to spend time with my kids and cook meals and do all that kind of stuff. And that was great when I was 25, but I'm 53 now. So my system doesn't recover as well as it did years ago. So about halfway through the week, I really start to falter. Like it really, really starts to get to me. So I find if I do vagus nerve stimulation twice a week for about 30 minutes to an hour or so, like I'm in a good place. That's about all I need. Now, if you take somebody who is um, like an endurance, like somebody who's training for a marathon and they're going on long runs all the time, that's somebody who's going to do vagus nerve stimulation probably every day because they're pushing their system much harder than the average person and they need that recovery. And, if you take somebody like when I had COVID, I got myself into a pretty bad situation. Like I was really smart at the beginning of it. And I went to all my friends to do integrative medicine, and they're like, oh, yeah, these are the herbs you need. Take these daily. And if you get sick, this is what you need. And so I had all this stuff lined up and had my Dolphin Neurostim ready. So when I eventually got COVID, which is, I think, the Delta variant at the time, like it was pretty bad for me. Like it really was. My oxygen saturation was hanging out around 90 or so, which is not great, but it's not awful. But I felt pretty crappy, had the COVID headache, whatever. Well, at some point, I decided I was doing better. So I was like, hey, I'm doing better. I'm not going to do vagus nerve stimulation today. I'm not going to take my little Chinese herbs. So I didn't do that. And I woke up the next morning and my oxygen saturation was 80. Like an 80 is getting into territory that is not so great. That's like a trip to the hospital kind of thing. And here I am. I can't get out of bed because I'm too weak. My children can't do much for me. I'm thinking about my kids, like what am I going to do with my kids if I got to go to the hospital? So anyway, I got my hands on my Dolphin Neurostim, hooked myself up, and I had it on for about 2 hours, maybe even 3 hours. But I got my oxygen saturation from 80 back up to about 90 over the course of a few hours. So it really makes some very positive changes very quickly because one of the things this does when you do vagus nerve stimulation is it stops the production of pro-inflammatory cytokines. It actually slows down the inflammatory response. So if you have people who have autoimmune disorders, be it a thyroid problem or MS or like take your pick of whatever, they're all manifestations. They're all systemic inflammatory problems that manifest in different ways. My stepdaughter was autistic. We used this stuff on her because it really helped her out. Toxic mold exposure, that's an example of something that responds really well to this. I have seen cases of people who were doing all the right things, doing all the right protocols and remove themselves from the mold who just weren't making any progress. They start doing vagus nerve stimulation and it pushes things along. So vagus nerve stimulation goes well with just about everything else. So how do you do it? All right. So you need the following things. You need a Dolphin Neurostim. You need this little black cord that has a cup on one end of it and a little metal prong on the other end. Let's see if I can hold it so you can see it. If you look in here, you'll see there's a little metal plate. This has to fit snugly over the end of the Dolphin Neurostim like that. So now I have a black cord hanging off there. You need one of these little oval electrodes. Important point, clean this off really well. This little metal plate, clean it off really well. If you've been using it, you're going to have oil from your fingers on here. And these little electrodes are kind of expensive. So if you clean this off really well, you can use these little electrodes over and over again. These are never going on anybody's body. All they do is they just stick right on here. So as long as that's clean, the oil's not going to compromise adhesive, and you can use these over and over again. You're then going to take a white cable. There are two variations of the white cable. Most of them these days look like this. They have a metal prong on one end, like a male end. The other end looks like a female connector, but if you look inside, you will see that is actually a shrouded male connector. So it doesn't really matter which end of these you use. Some hospitals require us to have this shroud. So you're going to plug this in to this little electrode. So now I have a white wire and a black wire coming off the Dolphin Neurostim. I need one of these rectangular electrodes out of the bag like this. So this is going to go on to the white cable. And if you look at with the Dolphin Neurostim, there's a card that shows you some placement stuff. And you will see that you want to either ground this thing on the left wrist, usually the left wrist. So you can put your right here, or you can go 4 fingers below the belly button. So you go right in here. Each of them is slightly different in how they affect the body. You're going to have to play around with it a little bit to see what works best for you. So I'm going to take this and I'm going to put this below my belly button. So white electrode below my belly button here. So now I have this black cable. You have a bag that has some little ear clips on it. Okay. So what do we have in our little bag of tricks here? Well, there are some black ones that have a little metal plate on them. If you have sensitive skin, I would stay away from these. You have two different versions of white electrodes. You have some that have black conductive rubber like this that are flat. And you have some that have black conductive rubber that looks like a little dome like this. These are the newest ones. If you don't have any of these yet, if you have an older set, you can call up or order online. You can order these from the folks at Dolphin Neurostim. Looks like my light's messed up a little bit here. So where do you use these? Well, to stimulate the vagus nerve properly, there are really 3 areas of the ear that we target. So we have a little ear here so you can see. So you want to either put it on the earlobe. That actually has one of the lower concentrations of nerve endings for the vagus nerve. The area with the highest concentration of nerve endings for the vagus nerve, there was a recent MRI study, and they found that the tragus, so this flappy little thing on your ear right here, like if you go and, when you push on your ear and you kind of close it up, that's the tragus of your ear right there. And if you put your finger in your ear hole, it actually pushes against the tragus. So this is the tragus. And this actually has the highest concentration of nerve endings. So if we get on the inside of that, so if we take one of our ear clips and get on the inside of that like this, that would actually be optimal. The problem is that most people's traguses, tragi, I'm not sure what the word would be, are so small that just slips off a lot of the time. So what tends to work best is using these dome electrodes. These are actually my favorite for doing vagus nerve stimulation. They work so much better than the other ones. Like this is what I use almost exclusively. So the other place is the upper concha of the ear, okay? So you got the little flappy thing right here, the tragus. If you come across and up there, this is the upper concha of the ear right here. This has the second highest concentration of nerve endings. It's funny to watch all you guys on camera looking for this. That's the entertainment for me. All right. So you're going to put this so that the dome part is up in the upper concha of the ear like this. And then you're good. Okay. Now, there are some things you need to know. This conductive rubber does not conduct well unless it is wet. So what I recommend is getting yourself some hand sanitizer because it's just alcohol gel. But you can use regular alcohol, you can use water, you can use whatever. I like using alcohol gel because it tends to stay on there and it tends to sterilize these at the same time. So you put just a little dab of this on here like that. And then you just go and you put it in the upper concha of the ear right there, and you're good to go. And so this will attach to and you'll see things are color coordinated to some degree. The black wire on this goes to the black wire, right? And the white wire here goes to the white wire of these rectangular electrodes. So we thought about that just a little bit, make it easier for you guys. All right. So now that we have this set up, what do we do? Well, you're going to take the Dolphin Neurostim, you're going to put it on the negative setting. We're going to turn it on. When you turn it on, if you have it on properly, and I don't, so you can test it by doing this. Watch. See the Dolphin Neurostim? If I put this on here, the circuit is completed. See how the light goes out? So that tells me everything is as it should be. So I can then take this and put this on my ear. I can take this. I can put this down on my tummy or wherever I'm going with it. And The light goes out on here, so I know I'm good. So now that I've got it set up, I'm going to use this little button right here. I'm going to push that button. Now, if it's on a high setting, it may flash. If it's on a low setting, it won't flash. So that's why I say don't look at the light. It'll just drive you crazy. And I'm just going to sit here. Like I can read a book. I can wash dishes. I can do whatever I want to do. And 12 to 14 minutes from now, it's going to go back to light out and a constant tone, which tells me that session is over. Now, I could press it again and do another session of this if I wanted to. And I usually do 30 minutes, sometimes even 45 minutes of vagus nerve stimulation for me. You need to play with it a little bit. Everybody's nervous system is a little different. Doing it on the left wrist actually covers a series of acupuncture points that are known as the golden triangle in acupuncture. These are all for all these points that this covers are anxiety points. They lower your blood pressure a little bit. They deal with anxiety very well. They calm your system down really, really well. So those are points you might want to look at. So how often should you do it? Well, I gave you my example. Twice a week seems to be good for me. But if you have something going on, you're probably going to do it a lot longer. So if I'm really sick, I might do it for a couple of hours and I might do it day after day. If I'm not sick, I don't want to do it too much. So when you first do this, I recommend 5-minute treatment and then just be done for the day. The next day, add 5 more minutes till you get up to around 20 or 30 minutes and see how you're doing. If you find that you are a little bit groggy, because this does calm you down, there is a trick to that. You can actually take this and put it on your right ear. You can put this on the positive setting down here. And you can run it for about 5 minutes on the positive setting. Now, I do recommend that you don't do more than about 5 minutes on the positive setting the first time. And I definitely recommend that you don't do it on the positive setting before you go to bed at night. It tends to be rather stimulating and it can interfere with your sleep. So if you like staying up all night, put it on the positive setting and, have a good time. If in the middle of the day you feel kind of like, burned out, you could probably put it on the positive setting and use it for that. But definitely don't do it on positive setting at nighttime. All right. Now, there's one other thing we need to look at. Depending on what version you have, there's what's called a Y wire. There's a smaller one if you have an older set like this. There is a longer one. This is the newer of the two. If you have this shorter one, you might want to call and get the longer set because this is much more convenient. So how do you use this? Well, we unplug our ear clip. We plug this Y wire on, and now I can put not one, but 2 ear clips on. So I can put these on both ears. And again, I like the upper concha of the ear, but you could use the earlobe if you wanted to. Again, we need to moisten these to make sure they conduct well. And then I'm going to put this, because I'm doing both ears, I'm going to put this on the biphasic setting, that plus minus setting right there. And it's going to flip back and forth between stimulating both ears. So it's more of a homeostatic thing. And I would recommend doing 1 ear clip before you mess with 2 of them. Most people respond pretty well to this, but I do have one friend, he responds very well to vagus nerve stimulation, but if he puts on this double clip, he gets instantly nauseated. His nervous system is a little odd. So play with these. They're really cool. This might be what is best for you, but you need to do it slowly to get your body used to it, and then just kind of work your way up on it. All right. So that is basically all the ins and outs of vagus nerve stimulation. There are a couple of other things I do need to talk about before we answer some questions. So I'm going to run you guys a few minutes late tonight. I apologize for that. But you got a little bit of extra information tonight. So other things you might want to know. If you find you have problems getting grounded with your patients, you can order one of these from the company. I think they're about $20 or $25. I think they're $25. It's a double wrist strap. One goes on you, one goes on your patient, and now you don't have to have skin-to-skin contact with your patient. You still need to touch the metal plates, but you are connected by this wire. We do make extra long ones of these, or have in the past, for people who treat horses, because they're super long. And they actually put these up under the root of the horse's tail because there's skin there. You can use these on horses, dogs, cats. Cats need to be pretty sick before you treat them because they'll get a little, well, they might hurt you. Let's put it that way. So this is a useful thing. In your kit, you also have an extension probe that looks like, let's see, where do I have an extension probe here? I know that I set one out here. Give me just a minute. All right, here we go. All right. You have an extension probe that looks like this. It has a cup on one end of it. It fits over the end of the Dolphin Neurostim. And you can use this to treat points in your ear if you want to. This is bendable. You can use it to treat points on your back if you wanted. We have people who use these for treating scars inside the mouth. They make the patients buy these. Again, these are about $25, and the patients take them home and clean them and bring them back. I used to use them in women's health for treating episiotomy scars, so we'd make the patients buy 2 of these. Obviously, you don't want to use this in certain areas, so we would use these extension probes, and that's what those are for. All right, so that kind of covers everything. Contraindications. Do what I call Joe's rule of pencils. Don't stick this thing anywhere you wouldn't stick a pencil, like, and you're pretty good. Don't jam it in your eyes. Don't run it up your nose. Don't stick it deep into your ear. Like, keep it out of the places you wouldn't stick a pencil. Don't stick it in an open wound. You're good. Don't stick it on top of your head if you have a history of seizures. There are acupuncture points that stop seizures. So certainly if you have epilepsy, you can use this. They're just points you don't treat. If you're pregnant, there are specific points you avoid. You avoid the top of the head. You avoid the top of the shoulders. You avoid large intestine 4. All those are points that push energy down. We're not trying to push energy out. And if you're pregnant, if you are treating someone who's pregnant, especially, I would make sure you get the doctor's okay first, whether they want it done or not. I used to work in a doctor's office, women's health. We used to use these all the time on patients, but the doctor ordered it, not me. Stay away from the first trimester because about 50% of all pregnancies end up in a miscarriage, most of them so early you never even know it. But if you happen to be the thing that's weird on a day when somebody has a miscarriage, you just don't want to be in that boat. And most miscarriages happen in that first trimester. Don't treat active cancerous tumors. This is considered to be a TENS device via the FDA. Now, there is a microcurrent. There is a microcurrent therapy on the market that is used for treating deep brain tumors. It is microcurrent. It shrinks brain tumors. This doesn't have that medical indication. You can draw from that whatever conclusion you want to. These work very well for treating nausea associated with chemotherapy and some of those things, boosting your immune system. You can do a lot of those things if somebody has cancer. Other things, small children are fine. Just turn it down a little bit. If you have dorsal column spine stimulator or a backline fin pump or a bladder stimulator, or plates, screws, rods, all those things, joint replacements, those are all fine. No problems with any of those. Pacemakers and defibrillators, get the doctor's okay first. You don't want to fool with those unless the doctor says it's okay. I have treated pacemaker scars in patients, but the doctor told me to. The doctor wanted it. So unless they specifically tell you to, I would stay away from those things. And I think that's about it for contraindications. So we're going to go into our question and answer section here. And I have forgotten my glasses, so this is going to be a little challenging here. So let's read these. What's the difference between the blue tip device and the white tip device? The blue tip devices, the point finder is a little bit better, and the circuitry is a little bit better. And this one, when you turn it on the constant treat, is every 30 seconds is going to go beep and drive you bananas. This one, you put it on constant treat and it just runs and runs and runs until the session is over. This one is not timed. This one is. So that's why we upgraded and came up with this. All right. Let's see what we got here. Okay. Any advice or suggestions for using the Dolphin vagus nerve stimulation for autistic teenager? Yeah, go slowly. Most autistic kids are pretty smart. So if you just let them know what it does, I can tell you for my stepdaughter who's autistic, and this is before we had vagus nerve stimulation, we actually treat acupuncture points on her. But autistic kids tend to have a really overactive amygdala. So fear is a big fear and anxiety is a huge issue. And that leads to some really bad days in school. So I found if we did with diet, doing the dietary stuff as well, but if we did the vagus, well, if we did acupuncture point stuff with microcurrent, it significantly reduced the anxiety. And if you have an autistic teenager like who wants to know about this, like bring them on. Like these are free little tutorials. Like sign up for them and put them on here. Like I'm happy to talk to them. If they want to ask some questions, I'll answer questions. What else have we got here? Any contraindications with metal implants? No. Has there been any evidence of stored insulin release? Wait a minute. The stored insulin release from tissues when treating insulin pump scars? Not that I've heard of. We've treated a lot of people with insulin pumps. Is there a specific wording that should be used in consent and release forms? If it's within your scope of practice to do microcurrent, then it's within your scope of practice. If it's not, it's not. How soon after surgery can you start treating a scar? Immediately. It will help the healing process significantly. How can you locate internal abdominal scars to treat them? You don't really have to know where they are. You just have to pretend like you're a pirate. X marks a spot with pirates. So if you just do like a big X across your patient, you pretty well covered all the internals, right? If you pretend there's a scar that goes all the way across and a scar that goes up and down, then you will have basically run current through everything in there that needs it. You could get creative and do an X this way and do an X this way. You just need to run current through that. The more time you spend doing it, the better it's going to release. Will you get a 20% reduction in scar density with each treatment? Yes, you will. Is it possible to release all adhesions to that scar? I've seen scars that looked almost 100% after a number of treatments. So mostly I don't treat scars for the visual aesthetics of the scar, but I can tell you that this does, if you have a hypertrophic scar that's purple and red and ugly, like this changes the color of them, usually in one treatment. If you have scars that are dipped in, they'll raise up. If you have scars that are raised up, they'll flatten out. It is a significant change when you treat them. How did you test your oxygen with a pulse oximeter? Can you treat lower back pain just using the ear points? What are those points? Yes, you can treat low back pain just using the ear points. The ear is very, very powerful. It is also very complex. We do a whole course on ear acupuncture. If you want to play with treating ear points, I would recommend that you look up the 5 battlefield acupuncture points. Battlefield acupuncture is used by the military. It's 5 points in the ear that are pretty easy to find, and they treat most types of pain. The entire body is represented as an upside down fetus in the world of acupuncture, and it is quite accurate. So this is kind of what it looks like right here. So you can see everything that's represented. It is quite complex. And I recommend that if you're going to start doing a lot of stuff with the ear, you take one of our auricular courses because it does get complicated. And you can certainly treat the ear for the back. You do miss out, though, if you don't treat the back because you're treating in areas where there might be nerve impingement. So I do recommend treating the area where there is a problem. All right. Can you treat rashes like a scar? Yes, you can. You can even treat shingles. Now, there's a whole shingles protocol, but treating around the shingles themselves is pretty effective. Dermatome charts. These are available if you want one from the company. They don't, like the big ones behind me, you can only get those at workshops because you have to send out a whole mailing tube with them that uses like tons of paper. It's so incredibly wasteful, so they don't send those out anymore. You can order these. So this will, if you look at these, you can look where all the nerves run. So One of the strategies we teach is that if you're having pain somewhere, so let's say you're having plantar fasciitis, it doesn't really do any good to treat the foot. That's not where your problem is. Most people tell you, well, you need to stretch out the calf right here, stretch it out on the stairs, but something has to keep the calf tight, and that's where everybody misses it. Okay. So you could do everything you want to this, but if something is keeping this tight, then you're kind of in a pickle. So if you look at a dermatome chart at the back of the calf, you will see that the back of the calf is innervated by S1 and S2. So that's these sacral nerve roots right in here. If you have irritation of the sacral nerve roots, it increases acetylcholine levels down that pathway. Acetylcholine is the neurotransmitter that makes muscles not spasm, but contract. And we'll keep this contracted and you'll get plantar fasciitis. So until you treat the sacrum, this doesn't go away. I've treated a lot of plantar fasciitis, and most of my outcomes come from treating this area right here. All right. So that's one of the ways you would use dermatome charts. I think they're about $10. Will there be any courses in Palm Beach or Martin County? I know last year or this year I was down in Vero Beach, and so yeah, we might get down that way. Let's see what else. If you request it, if you have a group of people who want it, we will certainly show up and do a course for you. We just need to make sure we have a place to do it, and the right number of people. What is a simple protocol for a prolapse bladder? There's a whole protocol for it. I don't have it sitting right here, but I would treat all the nerve roots in here that deal with the bladder. I would also treat over the entire abdomen like you were treating for a scar. If you look up in this book, Natural Health, let's see here. What's the protocol in here? I would say that if you use the menstrual cramps protocol, you would hit a lot of the same points you would be using for a prolapse bladder, except that there is one point, I think it's right here, below your nose and your lip, right in the middle here. That's a point that I have actually seen that change prolapse bladders in the past. But anyway, you can ask questions on our Facebook forum. We can get a little more information on that. Oh, it's nonverbal, severely autistic. You definitely would have added him. So if he's nonverbal and autistic, the big thing, generally speaking, is kids who are autistic don't like really loud noises, and they don't like anything that's really uncomfortable. But if he will tolerate an ear clip on here, and I would probably shoot for his earlobe, and then a little electrode on his hand, he will probably tolerate it just fine. Keep the unit on the low setting, just in case his ear is hypersensitive, and you should be good to go. If you need further advice, you can certainly post some questions, and we will do what we can to help you out. What else do we have here? Airbag scars on shins. How many treatments should we use? Roughly 5. Could be a little more, could be a little less. We know it's an average of about a 20% reduction in the overall density of the scar. Believe I saw this pairs well with dry needling. What do they mean by that? Can it be done at the same time? Once the needles are in, can I hit the other points with a microcurrent? What if I'm using, okay. So here are the things. Yes, you could do vagus nerve stimulation while you're doing dry needling. One of the big problems that dry needlers have is they don't realize what they're doing to the sympathetic nervous system. You can put somebody in sympathetic overdrive and actually make their pain worse by doing dry needling if you don't do it properly. They don't teach that in most of the courses. Can be done at the same time. Yes, it can. I absolutely do not recommend doing stimulation through the needles. That is an alternating current device. An alternating current will increase your cortisol levels, and it will decrease your heart rate variability, and it'll decrease your high frequency vagal tone. That's not widely known, but we did some testing a while back, and I would generally just stay away from that. And that's going to piss off people in the world of acupuncture, but I don't really care because we do the science on this, and I'm concerned about patients' health. The reason that you have an alternating current stimulator is because in the old days, needles tended to get polarized by direct current, and they were not stainless steel wire, and they would break much more easily if they became polarized, which is why I use alternating current so it wouldn't get polarized. Do what you want to do, but I don't recommend it. And it makes a whole lot more sense to have the needles in and pass current by the needles than putting current through the needles. It's too much. You're trying to get things to calm down. All right. What else have we got here? Is there a protocol for varicose vein? You can treat a varicose vein like a scar. I have seen some varicose veins completely disappear. I've seen some that disappear and then they come back. So you have to keep treating them. Were there many live courses in Palm Beach or Martin County? We talked about that. What else do we have here? Had surgery to cauterize the electrical place of the heart where the electrical loop in the heart stayed in the tachycardic speed. Can I use a Dolphin for that? I would say probably that would be fine, but I would check with my cardiologist first. It's just a scar. You know, you're not, I mean, we treat around the heart and scars around the chest all the time, so that's not really a problem. But I would check with your cardiologist first. It's always best to err on the side of caution with stuff like that. Let's see here. I noticed in the Vagus Nerve Manual, it recommends to do enteric nervous system and enteric gut microbiomes on pages 34 and 35 prior to vagus nerve stimulation, and then the nervous system points on page 13. Does this ensure that it works better? How do you treat tennis elbow? Well, those are two completely different things. But all right, so yes, doing that is a better way of doing it. So if you look through the vagus nerve book, those protocols are much more informative than the little bit of information I could give you right here. So definitely defer to those. And how do you treat tennis elbow? In almost 30 years of treating tennis elbow, I've seen exactly 2 cases of tennis elbow that actually came from playing tennis. All the rest of them did not come from playing tennis, and most of those people didn't even play tennis at all and weren't doing anything to deserve it. So you have to look at tennis elbow as being a problem up here and not down here. If you just treat this, it's not quite as effective. My background is in manual therapy, neuromuscular therapy, and structural integration, all that kind of stuff. I can tell you right now, like treating this is great, but if you don't treat the nerve roots that feed this, it's like plantar fasciitis. Like if you don't look at the nerves that are affecting the area, so generally there's something going on in the neck. But if somebody's neck is off, chances are they have a low back issue as well. That's creating a leg length discrepancy that's causing them to torque their neck a funny way. And then that's affecting things down in there. So treat the low back first, and then the neck, and then the tennis elbow, and you will get much better outcomes. How many students? 12 students guarantees us. If you have a place for us to do the workshop, maybe we could take it as low as 10, but shoot for 12. And I mean, unless you want to dicker with a guy who owns a company, I'm sure there's a rate that he would charge you. I'm just telling you in general what it costs, you know, how many people we have to justify bringing myself or one of the other instructors down here and down there and putting us up in a hotel and all that kind of stuff. Can a patient who has a cancerous mole removed recently be treated like it was a round scar? Yes. There's still cancer to be removed in a second surgery. If they're going to go ahead and do surgery on it again on the same place, I might just leave it alone until they get done with it. What's the difference between this and frequency-specific microcurrent? Frequency-specific microcurrent is they have, if you look into the hardcore science, everybody pretty well agrees on the fact that if you use low-frequency direct current, there's a monophasic square wave between 2 and 4 hertz at a 50% duty cycle, somewhere between 80 and 800 microamps, around 8 volts or so. It will increase ATP production, increase cellular membrane transport, increase protein synthesis, increase heart rate variability, increase high frequency vagal tone, decrease cortisol levels. Like all those things happen in research with the same electricity. Frequency specific microcurrent has this idea that certain problems and certain pathogens in your body, so it's in a way kind of modeled after the Rife machine. Certain pathologies have a certain frequency, or certain disorders have a certain frequency they respond better to. Um, and that may be the case. Part of it that I find a little interesting is that the person who came up with it said that they found all the frequencies written on a piece of paper in a desk and never explained where they came from or what the science was behind them. So, like, keep an open mind. Um, I know some people do frequency specific microcurrent who swear by it. I've never really had much reason to go beyond using basic microcurrent therapy for most of the things. I find that as a general rule of thumb, this will outperform most other therapies where there are acute problems. It's not that other therapies are bad. I incorporate all kinds of things with my patients. This is just happens to be, which let me address this. It doesn't matter what you do. If you're an acupuncturist, you're a physical therapist, occupational therapist, massage therapist, whatever it is you are. If you do this first, this makes everything else easier. This removes the barriers to your patients getting better. So work smarter, not harder. Like, don't bust your ass trying to get a 20% reduction in pain where you can do a 10-minute treatment of this, knock their pain back by 50%, and then go on and do the rest of what it is you do. So I do recommend using this as a frontline therapy because it tends to make everything else easier. And I'm at a point in my life where I don't like to work quite so hard. I like my outcomes to be really good, and I don't like to have to hurt myself to get them. All right, what else have we got? Any concerns with doing scars inside the belly button? The belly button is considered to be off limits in acupuncture. It is so I will bend the rules a little bit and say, like, hey, if you're kind of treating around the rim of the belly button, you're fine. Just don't go directly into it. There's thousands of years of people in the world of acupuncture saying don't treat directly in the belly button. So I'm not going to mess with that one. Can I treat eye strain with a dolphin? There are eye acupuncture points, and I have I have a patient right now who has had eye cancer, and they did all kind of weird things, like put gold foil in her eye that had radiation, and it gave her like a laser eye for a little while. People couldn't stand in front of her. It's kind of weird. But anyway, she ended up with some eye problems, and there are eye acupuncture points. There are whole protocols. They're down around. There are some of the points that are down around the outer shin. There's a point on there called eye bright. It's on the gallbladder meridian. I can't remember if it's. I can't remember which acupuncture point it is, but it's on the gallbladder meridian. If you just look up eye points on gallbladder meridian. Do I treat a bulging disc in L405 in the low back with the low back protocol? Absolutely. I spent years working in pain management, neurology, and neurosurgery practices and treated tons of bulging disc problems. And there's actually a lot you can do for those. The thing to keep in mind is that treating the back is important, but you got all these muscles up here, including the deep hip flexors like the iliopsoas group. If you don't treat those, it's difficult to get outcomes back here. So to do that, there are points on the toes called the Jing or Jing well points. They're probably in that back brain protocol, and they will do a good job of releasing the muscles in the front. And also, you want to treat the front, even if you haven't had a scar, treat it like a scar to help release some of this to take the pressure off the back. Very, very important. Okay, that is all of the questions I see written down. Does anybody have a question that oh, wait, there's one more. I have turned my calf muscles several times from sports approximately 10 years ago and have quite a divot and causes leg issues. So definitely treat that like a scar. And I would treat the low back too for that one. Yes, you can definitely treat that. All right. Anybody want to ask any questions via voice or, with your hands or however you want to do it? You can unmute yourself and ask away. Like, you guys have got it all. Okay. Well,
I do a quick one.
All right.
I did ask a question about the internal abdominal scars. I
Yes.
recently had laparoscopic hysterectomy through the
Okay.
belly and through 3 other points on my belly. I also
Yep.
have 4 friends who had the same thing and one that's about to go get it done.
Okay.
When I asked the question about treating that, I
Mhm.
don't know where the scars are, but you said to just kind of just treat the whole area because I can't get
Yep.
around. I don't know where the scar starts and ends.
Yeah,
I
you
think
just treat the
on
whole
the
area. Now,
scar.
what I'll tell you that you can do that'll be helpful, if you put this little thing on here, like this
Yeah.
little one of these O electrodes
Yeah.
and one of these electrodes, if you put this on the back
Yeah.
and just, and then you can go through the front using 2 units, and now you're pulling current directly through the body.
Oh, nice.
So you're
Yeah.
really pulling it deep through there. And I would say, spend a good 20 or 30 minutes just treating lines. Like just if I mean you can even take a marker and just mark lines this way, this way, this way, and this way. Just make
As
X's.
if those are scars, I'm going on either side of it, back and
Yeah,
forth.
and just treating all those as though it were a linear scar. You're going to drive enough
Yeah.
current through there to get some pretty massive relief. Do remember this. If you've had a recent surgery, so scars go through a tissue modulation phase that lasts for a year or two. So they do continue to change. So a very old scar, in some ways, is easier to treat than a new scar because the old scar is set. Like whatever you got is what you got. If you have a new surgery, like that's going to continue to change. So
Right.
you may want to go back and retreat it. However, treating it now versus later dramatically decreases the chances you're going to have abdominal adhesions that bother it.
Right.
So the sooner you can get going on that, the better. I would get your group of friends together and I would teach them how to do this so you
Yeah.
can treat them and they can treat you. And
Yeah.
trust me, it is one of the better things you can do for them.
When you put the pad on the back for the one pen, the other pen doesn't have the pad on the back because I'm using 2 pens. It just takes 1
Yeah,
pad on.
one is enough. It's
Okay.
gonna pull the current through, and you're gonna be good. If you wanna put 2 pads on there, that's fine, but it
Okay.
it seems to mix the current nicely if you have 1 pad on the back and
Okay.
don't have one on the other.
Okay. Thanks.
Um, can this help with weight loss? Vagus nerve stimulation is definitely a way to help with weight loss. Most people who can't get past weight problems, usually there is some systemic inflammation going on, and vagus nerve stimulation will help that significantly. But there are ear acupuncture points that are really good for stopping cravings. They're the same points. It's called the NADA protocol, NADA. It's the same points you use for heroin addiction and nicotine withdrawal, like all those. Those same points also help with food cravings and stuff like that. They work actually quite well. All right. Any other questions from people? You guys good? Oh, wait. Let somebody buzzed in here. Let's see what we've got. Will it cause any fat loss? It may level out your metabolism. I've known people who were trying to lose weight who used this along with it and found it to be easier. Um, that's about the best I can tell you. All right, guys. So we are at 9:07 now. So I've run you over a little bit. So you're going to get a link tomorrow. You can watch this over again. If you would like to sign up for this and take it again, I may be wearing a different color shirt and we might be talking about something slightly different. It's normally the same stuff. We do offer a series of in-person workshops. I recommend taking those. You get a lot out of those. We do have some interactive online workshops where there's somebody live teaching it, and we do have some pre-recorded ones. So all those are available. If you sign up for our Facebook forum, we will alert you when there are upcoming workshops, and we'll send you a little email too. We're not going to blast your email all the time.